Hello, Edward here from Good News People, and today we're going to be talking about a potential new game-changing treatment for the future of OCD and ADHD. Now, this all started with the research of two professors, Professor Fulvio D'Acquisito and also Dr. Diane Cooper, respectively from the University of Roehampton and Queen's Mary University of London. Now, they were studying something totally different, autoimmune diseases, with looking at multiple sclerosis and also lupus, and how having higher levels of the protein enzyme A1 plays into the development of autoimmune diseases. For their research, what they've done is create a transgenic mouse that overexpress these proteins in their T cell, one of the main cells responsible for the development of autoimmune diseases. When they were observing the behavior of these mouses, however, they found that these mice were highly anxious, showing signs of excessive digging and also grooming, showcasing that these mice were experiencing their own version of OCD. Now, when they taken a look at the chemistry of these mouses, they found out that they had higher levels of immunomodulin, which is a protein, or what the professor and doctor has now coined iMood. From this point, they've started to treat the mouse with giving them antibodies to prevent the body from overly developing the iMoods, and they found that within just a few days, their behavior became what would be considered normal for a mouse. So there is, according to Professor Fulvio D'Acquisito, that there's mounting evidence that the immune system plays an important role in mental disorders. And in fact, people with autoimmune diseases are known to have much higher than average levels of mental health disorders such as anxiety, depression, and also obsessive compulsive disorder. Taking a look at how this affects humans, they've taken two groups of people, a control group with 23 volunteers and also a group with 20 patients who are currently experiencing OCD. Now, the group with 20 patients have shown to have 6 times as much iMoods in their bodies as the control group. Other research also suggests that the same protein plays a role into the development of ADHD. And together with these previous findings, the team is very confident that this showcases the role of this protein and how it plays into having mental health disorders such as both OCD and ADHD. Now, there's still a lot of work to be done, and what they want to do right now is to have larger samples of patients to see if they can replicate the same results that they have in their small numbers that we've been looking at. At the same time, they've been partnering up with a pharmaceutical company, UCB, to start developing the antibodies and to see when we can put this out for clinical trials. Now, according to Professor Fulvio D'Acquisito, this may be something that we see in the future is very promising. It can take about 5 years to get it out. Thank you for joining us on Good News People, and we hope that this was some good news for you today.